So moving swiftly on. So we've just got, I think there's lots of people coming up from it's the Royal Berkshire team now. I don't know how many people we expect to join me on the platform here, but there's a lot of names. Some of you might stay there. Fine. Yeah, so an introduction. Yeah, let's start things. So this is about something that's very close to my heart, and that's what we do with our young people who are prepared for transfer in our service over into adults. So this is great to hear about some transition programme work. So I'll hand over to you all, I think. Yeah.
Thank you, Fiona, and thank you for giving us the opportunity to speak today. So for those of you who don't know me, I'm Dr. Joanne Spinks. I'm a consultant paediatrician from the Royal Berks. This is Fania Kavora, who's a consultant physician from our young adult clinic. And over here we've got Andrea Jones and Boyke Osapang, who are nurses, paediatric diabetes specialist nurses, and Boyke also works as a young person's nurse in the young adult clinic. We've got Josie Winter over here, who's our nurse from the young adult clinic, and we've also got two young people here who are brave enough and kind enough to travel, who attend our clinic and have started our youth council, so they're going to talk about that. So I'm really privileged, I feel, working at the Royal Berks, because I've got clinicians from the young adult team, and I've got clinicians, our PDSNs, and young people who are really committed to developing our transition service, and in particular, they've set up a youth council. And so we'd like to present what we've done with our service and how our youth council works. So the talk's going to take three parts. Firstly, Fania's going to talk about how we've developed the service and how the youth council started and the evolution of it. And then Phoebe and Talia, who are the young people in our clinic, are going to talk more about the role of the council and how it's shaped our service. And then we thought we'd have a question and answer session at the end for people to talk about how the systems worked. So I'd like to hand over now to Fania, who's going to talk about how the service developed.
Thank you very much, Jo. Thank you, everyone. And it's a great pleasure and honor to be here talking in front of pediatric colleagues. I'm an adult diabetologist, but I've been involved in a few projects working closely with pediatric diabetes specialist. So I'm here representing the team. This is not my work by no means. This is the work of a lot of people who have given hours outside of their working hours to develop this. Talking about what we're going to be presenting, I'm going to give you an overview of our team, talk about the evolution of the service, how we provide care at the moment, and a little bit in the end for our future plans. So this is who we are. We are separate teams. The children's clinic is led by Jo Spinks, who is here today with me, and other consultants. And Andrea Jones, who is sat over there, is the lead diabetes nurse. Boyke Osapang is very, very instrumental in all of this, and I want to thank him from this podium, because without him, I don't think we would have achieved all of that. And he works across the pediatrics and the young adult service, so he takes over the care of people from the age of 16 up until they're 19, so even after they transfer their care to the young adult clinic, which is a very pivotal feature of the success of our service. We also have dietitians working in the pediatric clinic, psychologists, and of course we've got admin support. From my side, I'm the lead consultant. I'm single-handed doing this clinic with occasional help from my registrars. We're very lucky to have recently been able to appoint Josie, who is an established diabetes nurse but has jumped the boat and is now part of the YAC team. And we are also supported by the adult dietitian and psychology team, and very recently we started having some formal admin support by Wendy. We are, I think, quite a big service. We've got about 280 people in the children's clinic. Most of them are kind of a bit older than very young children, and about 280 people in the young adult clinic. We see people from the age of 16 to 25. The vast majority transition around the age of 18 to 19. And we proud our service for delivering a seamless and integrated service for young people with diabetes. And this is kind of a staged approach. My pediatric colleagues have launched those age-banded clinics for young people in a way to try and bring people of similar ages together, so they can form friendship and provide peer support and also more appropriate education. They provide age-specific education events, starting with a Year 6 event, preparation before the exams, and they also run on their non-working hours age-appropriate spear activity events like bowling evening or an escape room evening. In the last 2-3 years, we've had a variety show before Christmas, which has been a huge success. And also the other very popular event with young people is a go-karting event. And our kind of flagship event, I would like to say, is the annual Young People with Diabetes event, which we run now in the summer. And it's run by professionals, but also patients, or our young people who come to the clinic, and parents. It all culminates to the transfer of care or transition clinic. We have 4 of those clinics a year, and we transition between 6 to 8 patients per clinic. Now, as I said, this is an evolution of service. This is not something that developed overnight. It's taken us a long time. And it started really when I joined the Trust back in 2016. And very soon after joining the service, I had my first visit to the pediatric department to do the transition clinic. And after working very closely with them and chatting on how we can get things better, we came up with this idea of the Young People annual event. The first one ran just before Christmas in December 2016, and since then it has become an annual event. In 2017, the Children's Clinic launched the age-specific education event. In 2018, we started having the age-appropriate peer activity event. Then in 2019, we launched something we're very proud of, the Berkshire Young People with Diabetes Council. Now, this was a crazy idea that we started discussing with Boyki in one of my clinics on a Wednesday afternoon, saying, how can we bring young people together? Something that very often hear in the clinic from patients is that they feel very isolated because they don't know many people with type 1 diabetes in their family or in their peer groups. And we thought, can we do something like this to enable peer support? And actually, could these young people help us in designing our service and making it more approachable to them and better suited to them? And despite the pandemic landing on us in March 2020 and everything shutting down, our young people really embraced this and take it on. They continue to do Zoom meetings. And officially, we launched the Berkshire Young People with Diabetes Council in September 2020. It was launched by the then acting CEO of the hospital and Theresa May, who delivered a message to the young people on the day. And in 2022, the Children's Clinic started running age-banded clinics. And we've done quite a few things in 2023, so we restructured completely the way that we deliver the transition of care clinic. We were lucky to be able to employ Josie as the young adult diabetes nurse who takes over the care from Boyki after the age of 19. We launched this peer mentorship scheme, and our young people who are part of the BYPDC have been one of the very first to be recruited by Diabetes UK Youth Ambassador or Leadership scheme. They're going to be talking about that. I'm not going to steal their glory. So this is a photo, some of us, back in 2016 on the inaugural event up here, and then we ran this in a hotel the first year. The second time in 2017 it was in Reading College, and since then it has run in Reading College. You can see how few of us were in the first event and how many more in the second event. Let me talk a little bit more about what we do on this event. So we invite all young people after the age of 17 when we are preparing them for the transfer of care. In a way, we are trying to enable more independence in managing the diabetes. We also have separate sessions for parents, and this is something that was fed back to us by parents. They wanted to be involved in all of this because transition is a huge step, not only for the young person, but also for their families. It's delivered by a multi-professional team, including doctors, nurses, dietitians, psychologists from both teams, and of course patients. Nothing could happen without our young people. Lots of topics are covered, topics on sexual health, alcohol, drugs, living away from home, practical tips about university, which are, the sessions are run by our own patients, our own young people who come back very joyfully from university to speak to their peers about their experiences. And the agenda is really developed in collaboration with BYPDC. We sometimes have representatives from Diabetes UK, JDRF and DVLA. And we also have some fun stuff like live music from young people who are part of the clinic, and we end the day with some pizza and a quiz and a prize. Now, I'm going to talk a little bit more about the BYPDC. So, as I said before, the idea initially was that we create a forum for young people attending the Young Adult Diabetes Clinic at RBH with the aim to help us get kind of insight from them on how they would like to shape the delivery of the care, and also to create a peer support group for young people living with diabetes in the area. This is not about giving medical advice, this is just sharing their lived experience of living with diabetes. So this is the inaugural meeting. We met in a nice restaurant in the centre of Reading in October 2019. Phoebe was there. You can see Phoebe presenting. She's been with us from the very beginning. And we called it the Berkshire Young People with Diabetes Council. The young people came up with a logo. They designed it, and here it is. And as I said, in September 2020, on our virtual young people event, we launched it officially, and Theresa May was one who delivered a nice message to all people, very inspirational message. And finally, I'm going to talk to you about how we've redesigned our transition transfer of care clinic. So we've evolved the way we run the clinic over the years, again, taking feedback from the young people, the BYPDC members and their parents. As part of all this work, we've developed, or actually with very significant help from young people, this Young People Diabetes booklet, which includes a huge amount of practical information for patients, and it also includes personal stories and reflections from patients. So that's something that we give to everyone when they come to the transition clinic. And the way the clinic runs is of various stations, and I'll show you what I mean by that. And it is important to highlight that this is a clinic not just for the young person. If they choose to bring their parents with them, then the parents do get separate sessions as well. So the young person is at the center of all of this. They meet doctors. It's their opportunity to meet me and for me to meet them and get a transfer of care from Joe. They also meet Josie and the other diabetes nurses, the pediatric diabetes nurses. They also get into a group and they visit our young adult clinic, which is in a different building to the children's clinic. And there they get to meet the team. They're given, practical things like the code to link to LibReview, for example. The psychologists from the children's clinic and the dietitians are also available in case people want to speak to them. And we are very privileged to have a representative from our BYPDC talking to the young people as well and following them in the YAC clinic on their visit. And, we do the same thing for parents, so if they want, they can come to the clinic and meet myself. They can meet Josie, they can go and visit the young adult clinic, they can speak to a psychologist or dietitian, and very importantly, a parent's representative is also there speaking separately to the parents and kind of talking them through what is going to happen. Now, I don't know if we're going to be using flying cars in the near future, probably not, but what I know is what we've got in plan. And this is to try and incorporate all the members of the MDT into the transition and transfer of care clinic. What I mean by that is also get the adult psychologists, dietitian on board, who at the moment are not involved. Expanding our workforce is always key, and it has helped us a lot recently to provide even better service. An issue that we face mostly in the young adult service is the attrition. So a lot of people transfer their care, but they never come to the clinic. So we are going to try and have some dedicated admin person to look into that and how to ratify it. And we've set up regular team meetings, including all the members of the team, and also inviting representatives from the BYPDC. And something that came to me, I don't have a logo for the YAC clinic, I need to get one. So I'm going to be launching a competition among my patients to get that done this year. So thank you very much all for your attendance. These are just a few names of the people that have helped us to get to this point. And as I said, Joe, Boyke, Andrea have been extremely instrumental in all of that. I'm very grateful to the young people who have really embraced our efforts, and patient representatives as well. Thank you very much for your attention.